Nurses make rounds on patients to monitor them and make sure that their needs are being met during a hospital stay. Martha Jefferson Hospital recently added a tool to enhance rounds done by its medical staff. In this week's HealthWise report, we take a look at Orchid Rounding.
Good morning. No one wants to be in the hospital. No one chooses to come. So we want to make their experience as pleasant as possible.
A new tool has been added to the Martha Jefferson toolbox, and it is proving handy for both staff and patients. It is a software called Orchid, and so in addition to making the traditional medical rounds to patients, nurses are also making what is called Orchid Rounding. Nurse manager Frances Manley explains.
We've been rounding on our patients for years, but this is a real-time tool. This allows me to tell dietary, this patient received the incorrect meal for lunch today, and it immediately goes to a staff member there, and they will be able to respond within an hour.
In addition to immediately meeting a patient's customer service needs, all of their information is entered into the system, so every staff member who comes in contact with that particular patient can see the history of their stay, leaving little room for confusion and plenty of room to resolve any issues that may come up before discharge.
We want every patient to have a good experience every time, from the first person they see when they walk in the door to the last person they see when they leave. And we feel like a tool like this will be able to make sure every department is working at the same level of expertise every time.
That's because Orchid allows hospital staff to track and trend, so focus can be put on any areas that need improvement. Manley says Orchid is also useful because patient responses that are captured in the system reveal when staff is doing a nice job.
We don't always want to focus on the bad, and a lot of our patients have a lot of good things to say, and we want the ability to highlight those staff members as well.
Orchid Rounding is on its second week at Martha Jefferson, and so far the response has been very positive from both patients and hospital staff. Dan?